Good evening, ladies and gentlemen, and welcome to a second edition of 103 FM's Men's Health Clip Hour. I'm Dennis Webster. I'll be your host this evening, and joining me again is Dr. Flavio Cardone. If you've missed the first show last Tuesday, Dr. Cardone is a medical doctor as well as an attorney at law. His focus is internal medicine. My background is as an RN case manager, trained in oncology nursing. I have over 20 years experience in prostate cancer and prostate cancer management. Before we start, ladies and gentlemen, if you have questions and you would like to call in, we ask that you do so during the hours of 9 to 10, which is when our program is running. We can't take calls after 10 o'clock, so if you want to call, the number here is 628-4103. You can also choose to log on online at 103fm.net. That's 103fm.net. Or you can text us at 4103. That's 4103. Before we get started, I would like you to know that the station and I would like you to always seek advice of a physician or other qualified healthcare provider if you have questions regarding a medical condition. We don't make medical diagnoses on this show. We are here for some general discussion on different men's health topics. We ask that you never disregard professional medical advice or delay in seeking it because of something you have heard on the radio program. So let me welcome my guest tonight, Dr. Cardone. Welcome back.
Yes,
nice
hello,
to see you
Dennis.
again.
I'm here again.
And I'd like to add one more person. We have in our studio today Greg, who's going to be our technical director, and he's going to keep us flowing smoothly. Thanks, Greg. So, Dr. Cardone, our topic today is going to be erectile dysfunction. And, we've had a little discussion about this prior to the start of the show, and I guess some of your stats are a little bit different from mine, but they're still on the high side. From my experience, I know that about 40% of erectile dysfunction is caused by vascular disease, which is an abnormal condition of blood vessels. And I've worked with many urologists in my practice, and I know the first thing that any competent urologist will look into if you're having difficulty with ED would be your vascular status. Dr. Cardone, you would like to expand on that?
I would say that first, a difference must be made to see if the erectile dysfunction is caused by also psychological problems, because not always, it doesn't have to be organic all the time.
Right.
And that's probably the first thing the doctor should assess with a good history, good questioning of the patient. Then more or less the doctor will start to have an idea to see if it's psychological or organic in nature. Unfortunately, as we were talking before, one of the main causes of organic erectile dysfunction is diabetes,
Right.
which in Trinidad we have a lot more, and people get it at a much younger age
Right.
than in Europe or the United States.
I saw one report in 2013, I believe, in one of the newspapers, I believe it was The Guardian, that said we had like 150,000 people dealing with diabetes, and they were expecting another 1,000 annually to be diagnosed.
Well, that's then, if 150,000 would be, if I'm not mistaken, around 10% of the population here. So it's really a lot. It's a lot more than in Europe. And I see people here beginning to have diabetes when they're 40 years old, which to me was very rare. I mean, I never saw that before coming here.
Right.
And people don't understand. They think diabetes is, just a high sugar and nothing will happen. Maybe they will get some heart problem. But it's not maybe they will get a heart problem. They will get a heart problem for sure if they don't control their diabetes. And regarding erectile dysfunction, unfortunately, about half of the people who have uncontrolled diabetes will have erectile dysfunction. That's sure. It's not maybe.
Right, and diabetes is a multi-system problem,
Yes,
right?
yes. People start to have all kinds of problems, and especially because diabetes also destroys nerve endings. And once they are destroyed, they won't come back. Once vasculature, as you were saying, is also destroyed, doesn't come back. There's no medicine once something is gone. There's no way to replace it. This is why you see people who lose their legs because of diabetes, because of poor circulation.
Right.
And people can lose their eyesight because of diabetes. And especially as we are on men's health, especially men get diabetes.
And the kidney issues, we're having a lot of kidney problems.
Everything,
also.
But people don't realize that because diabetes, at the beginning, but they say diabetes doesn't hurt. So people have high sugar and they don't feel any pain. So they forget to take their medicine. Why should I take this metformin just because the doctor is telling me that my sugar is 200, but I don't feel any pain? Why should I care about that? And
I think that people are kind of taking this kind of lightly, like
yes, they don't realize how bad it is. And what is interesting that I saw in Trinidad, some people are very aware of the dangers of smoking, which smoking is something else that causes erectile dysfunction. And so they don't smoke, they keep away from smoking very well, but at the same time they eat
whatever.
Yes, they eat let's say that famous fried chicken,
Right.
and other things that have lots of fat, lots of sugar.
Right.
And they get diabetes at a very early age.
And into problems. I mean, there's things like diabetic coma also. People
Yes,
don't realize.
yes. And diabetes always ends with people taking insulin, and they have to inject themselves at least once a day, which is not pleasant.
Right.
And it's not a question of maybe it will end in insulin. It will reach insulin, but you can make it reach that point very slowly if you keep good control.
But you can have a good quality of life if you pay attention to this.
Of course. But you have to take the medicine and follow the diet, because just taking the medicine and not following the diet will not work. It's like you're filling a bucket and emptying it at the same time. It won't. It won't work. In fact, in Europe, the indication for metformin is the official guidelines is that metformin be used after diet and exercise have not worked for diabetes.
So after you've attempted these lifestyle changes, if it doesn't work, then you immediately get onto metformin.
So meaning that you should, you should be on a diet and exercise and then take metformin. If you just take metformin and eat the same things, then it doesn't work. But we're talking so much about diabetes because the topic is erectile dysfunction. And diabetes, half of the men who have diabetes will get erectile dysfunction, at least half, because you were saying before you read an article saying three-quarters.
Yeah, about 75%. The article also, which was very interesting to me, was it stated also that this same group of men, who are dealing with this erectile dysfunction, also have problems with hypogonadism, which is low testosterone. So you have them, dealing with low testosterone as well as the cardiovascular.
Yes,
issues.
that's a later stage too. And but I think it is important also that we, as I was saying, trying to establish if the erectile dysfunction is psychological in nature or organic.
Right.
So, we all have our ups and downs, but if it's sudden, if the man never had the erectile dysfunction And then suddenly one night he finds out he has that, and then after that night he has it all the time. Then it's usually psychological, which is good because it's, in a way, it's probably easier to revert. Yes. And if it's something that started to happen gradually, then it's organic, and if it's organic, it's harder to take care of it. Yes. There is of course medicine for this, but it can't be used forever. And since people with diabetes end up having heart problems, at some point they will not be able to take the sildenafil, the
PDE5 inhibitors.
Yes, because they're completely contraindicated if you're taking some types of heart meds.
Right. So what it actually does, is it can cause a very low drop in your blood pressure. Because the isodil and the nitrites actually cause your blood vessels to open up, and when they open up, if they open up too much, then your blood pressure drops, and then you can have a fall, and you can get
because you can have a stroke too because of that. I mean, you can basically die because of that, because of blood pressure. So imagine, it's the circulation is like a long tube. So you have a certain pressure in the tube. If you suddenly make the tube wider, then the pressure falls down because there is more space, less liquid. And so in this case, blood doesn't go to the brain, and people can have strokes. It's a very dangerous thing. And some men also, they take this kind of medicine, and sometimes they don't want to tell the doctor. And that can cause problems, especially when it comes to herbal medicine, because I know in Trinidad you have the bois bandé. I looked at some literature on it. I couldn't find anything proving that it works or proving that it doesn't work. I didn't find anything saying what it contains, so I don't know about
Well, we know there are a lot of drugs on the market. Some of them work, especially with the PDE5 inhibitors. We know that about roughly 30% of men are not going to get any effect from using them. So we know the drugs don't work for everybody.
Yes, that too. But one thing people should be aware in Trinidad is that sometimes they buy some Chinese herbs, especially one called horny goatweed, which which the name makes you think it's going to work. That actually contains a kind of PDA5 inhibitor, which is something similar to sildenafil. So in theory it should work, but if you're buying some pill made, you don't know who made it. Exactly. You don't know what is in there. You don't know
the active ingredient.
Yes, you don't know what they added to, because sometimes they add some more dangerous things to make you think it's really working, and you don't know the side effects. So I mean, you're risking a lot by taking something
especially
like that.
if you're already on medication. You don't know how this new stuff that you're putting in your system.
Yes, especially as this thing is sold, as a herbal mix, so you don't know what else.
What additives are in there?
For instance, I found. I was looking at this the other day, so I found a let's say commercial brand of this herb. And they won't say what other herbs are in there. I found it out because I've looked at the office where they registered their meds, and there they had to write
the ingredients in
it. But normally you won't know that.
Well, we're talking about erectile dysfunction this evening. If you would like to give us a call, you have questions, give us a call at 628-4103, or you can log on at 103fm.net, or you can text it at 4103. This is 103 FM, the first, the finest. We'll be right back. Welcome back, ladies and gentlemen. My name is Dennis Webster. I'm your host this evening for Men's Health Clip Hour, and we're here with Dr. Flavio Cardone, medical doctor and attorney. Dr. Cardone, yes, this ED issue seems to be a big problem in our twin republic. We've had many reports in the paper about the growing numbers of men being affected by ED, and as you just mentioned, diabetes is one of the big factors affecting men with ED. Another problem is the hypertension, and I mentioned the hypertension because a recent article I read also talked about some of the medications that we're actually giving men for hypertension can have a side effect of ED.
Well, yes, that's true, but also not only medicine for hypertension, heart medicine, especially beta blockers, can cause erectile dysfunction.
Yes.
But that that is something the patient should, if it happens, the patient should not be afraid of telling the doctor, well, this is happening now, and is it perhaps one of the drugs I'm taking?
Right. So a review of of his medication.
Yes, but that is a known side effect of some medication, and well, the patient decides what is more important for him, because we are not here. I think the doctor is not here to be the patient's nanny. If somebody decides I want to have my heart problem and my high blood pressure, but I want to, be able to have sex normally, then it's your choice, then no problem. But they should be aware of that. They should be aware that at some point they have to decide, well, either you take care of your heart, and you have to take this medicine for this. But
it's kind of sometimes being caught between a rock and a hard place. It's like, what do? You need the medication for your blood pressure, but then the same medication can cause you erectile dysfunction.
Yes.
It's like the Avodart that we give men for enlarged prostate. It does a great job at shrinking the prostate, but it can have side effect. One of the side effects is erectile dysfunction.
Yes, and sometimes people have to decide what is more important for them, and this is why. But to be able to decide, they have to be informed.
Right.
So sometimes the doctor tends to behave as the patient's nanny and tell them, do this, do that. I don't do that. I let the patient decide, and I tell them, look, you need this, and this will have this side effect, and now it's up to you to decide. Also, speaking of side effects, also a problem here, and that people get medicine, in the little plastic bags, without the leaflet that will list the side effects.
I wrote about that in one of my articles. It's I don't know how people keep track of what they're getting, what they're taking, how often they're supposed to take it, and when the medication expires, because everything is scribbled. Sometimes it's in what I call crapple foot writing. You can hardly make out what's written, and people need to know what they're taking, and they need to know also at what point maybe what they're taking is not working for them.
Yes, and all that, when you buy medicine in a box, like in Europe, you have the leaflet, which will list common side effect. In about 20% will be this. Right. In more than 10% will be that. Right. Of course, you have the problem of people who don't bother to read the leaflet. Right. But at least, they had the choice. Because in practice, the doctor can't tell the patient all the side effects of every medicine, because when you see those leaflets, it takes a while to read them. Right. They're not small things, and also maybe the patient will not understand what you're saying. Right. So
I know in Canada, though, the pharmacies in Canada, they with all medications that they give you, you get a printout of what the medication is, why it's been ordered for you, and things like that. I think we have a call on the line. Let me just see. Hello, hi, it's 103 FM.
Hello. Good night.
Hi, good night.
After long as I listen to the program,
Mm-hmm.
and I have a similar problem towards that. But it's not really similar, it's the same problem.
What's that, sir? Can you give us a little bit more detail?
Prostate problem.
Uh-huh.
You're not able to have sex properly as you should, I think.
Have you seen a doctor, sir, about that?
No.
And how long has this been going on? Has it been going on for a while now? Maybe it's time to see a doctor and get that checked?
Well, I think I had this problem since small.
Mm-hmm.
So, I don't know.
Yep.
How long have you been having this exactly?
Well, since I'm small.
Okay.
I know that.
So, you should really go and see a doctor because, by phone it's a bit hard to examine you. Somebody should take a look there and see what's going on.
Okay.
So, but don't be shy about that. Go to the doctor.
Yeah, go see the doctor and find out what's going on. I mean, the thing about it is, like everything else, the earlier that they can basically do something about the problem, the better.
Okay.
So it's best you go see a doctor and be checked out thoroughly, and get some advice on how to move ahead.
And don't be shy. Doctors are used to all kinds of things, so you can show them anything and talk about anything, so they won't mind.
All right. Okay. Any special doctor?
I know you can start with just a family doctor, and then he will determine whether you need to see a specialist or not. But I would if I were you, I would start first with a family doctor, and take it from there.
I would say a doctor who has the time to talk to you. That's important.
Like your relationship with your doctor is important. I mean, you need to have someone who's prepared to listen to your concerns, and guide you, properly. You don't want someone who's basically you walk into the office and they're already writing a prescription and they have not heard your story. So you want someone who's going to be taking the time to listen to your concerns seriously and help guide you and find a solution.
I would say it's a doctor that you trust is the most important thing.
Okay, thanks.
Okay, thanks for your call. Thank you, sir. Good luck. Yeah, it's difficult, and some people are, I think, experiencing, difficulty for a long time, and have not come out and actually try to do anything about it for fear, stigmatization, and I don't know why. Like, we need, I'd like the men to come out more and talk about it. Send me an email, talk to someone. No sense suffering silently.
Yes, also, because in practice what happens is that when people go to see their GP at a public health facility, usually there are lots of people there. And the doctor wants to move very quickly. So he's not going to ask about everything, because there is a difference when if you go to a visit to see a doctor who doesn't have time. The doctor will ask, how do you feel, what is going on, and you will tell them what is going on, and the doctor will do something about it. But if the doctor has time, then the doctor will ask you about many symptoms, about many things that perhaps you are not mentioning. But then you will be reminded of, why this is happening. So, for instance, if people have heart problems, one of the questions they should ask is, how many pillows do you need when you sleep? Because sometimes people have heart problems. When they lie down flat, they can't breathe. So they need to sleep with 2 pillows.
Right.
But if the doctor is moving fast, the doctor will just ask, what do you feel? And you'll say, well, I feel okay.
Right.
So, just give some blood pressure, but will not, really ask about everything. So I would say it's important to see what kind of doctor is examining you.
I think also, I mean, with the doctors that I did, that I worked with who dealt with erectile dysfunction, one of the standard forms that we were asked, especially if we don't have a lot of time, is the International Index on Erectile Function, which is basically a baseline assessment of your sexual function. So it asks, questions like, how would you rate your confidence that you can get and keep an erection? When you had erections with sexual stimulation, how often were your erections suitable for penetration, and those sort of questions? Because when you get a baseline assessment like this, it gives the doctor a starting point to work from. Yes, so you have a copy. Yes. So, and there's a simple 5 questionnaire that we use regularly, and it's able to give the doctor some sort of idea of what the problem is, whether it's a physical problem you're having, or whether it's as Dr. Cardone mentioned earlier, a psychological problem, because sometimes it can be one or the other, or a combination of both.
Yes, because erectile dysfunction also depends if it's really troublesome or not. Some people can think they have erectile dysfunction and it's just normal.
Like I tell people sometimes, one instant where there's a problem doesn't mean that it's going to be a constant problem.
No, and also, as I said, we'll have our ups and downs. So just
exactly.
that one down doesn't mean doesn't mean it will be
exactly.
It will be forever.
Exactly.
Also because but men have this that they're shy about admitting it.
Mm-hmm.
They want to pretend it's always it's always going to be great, but it doesn't happen
Not
all the time.
Right.
And in fact, you mentioned, you said something about the questionnaire. It had something. A part of the questionnaire is sexual stimulation. Mm-hmm. So, for instance, there are studies that show that up to more or less middle age, so let's say up to 35, 40, 45, imagination works more than touching. And after 40, 45,
right.
imagination doesn't stimulate the man so much, but touching does.
More tactile.
Yes, so, sometimes people can think, well, before I would see a picture and get ready right away. Now it's not working. But just because, you changed, it doesn't mean something is going wrong. It just means you.
And as we get older too, like our
yes, like people start needing glasses after a certain age. That's a normal thing. Doesn't mean something is happening to your eyes.
Right. So if you're out there and you're having some of these issues, and you're just needing someone to talk to, give us a call. We're taking a break right now. This is 103 FM, the first, the finest. We'll be right back. Welcome back, ladies and gentlemen. You are at 103 FM's Men's Health Clip Hour. My name is Dennis Webster, your host for tonight, and I'm visiting here with Dr. Flavio Cardone, medical doctor and attorney, and we are discussing erectile dysfunction. So Dr. Cardone, we have a lot of fellows out there, a lot of them probably having this problem. Give us some next steps. Like what do you do? What's the first step? What do you do first? What do they expect when they go to see their doctor? Can you give us a little bit?
So I would say the first step would be, going to see a doctor. That's if you're in doubt, if you think you're having something wrong, go and see a doctor. And the way the doctor will talk to you will give you more or less an idea if that doctor is a good choice. Yes, because if the doctor takes the time, if the doctor uses this questionnaire for erectile dysfunction, either the short one, 5 questions, or the long one, 15, then that's a good sign. If the doctor asks you what medicine you're taking, that's also a good sign. But I think the most important thing would be if you have to get the feel that the doctor is at least trying to make a difference to see if it's psychological or not.
Right.
If he's sending you right away to a psychologist, then maybe he doesn't want to deal with that. Or if he's sending you right away to a specialist, those two things wouldn't be a good sign.
So those are the red lights you're going to look for.
Yes, you should see a doctor who really talks to you,
Right.
who tries to find out what is going on.
Because it's a very sensitive topic, and you need to feel
Yes,
comfortable
yeah.
with the doctor that you're seeking help from.
Yes, because as I said, many men are, they're afraid of, they're shy about this, and it's very normal. And and sometimes it can happen that, with one woman it's not working, but with another it is working. And but they have to tell these things, because then it's obviously...
So you have to be honest and open with your doctor.
Yes, but I mean, because in this case it would be obviously psychological. So for instance, if people have conflicts with their partners, that can happen.
Right.
And then it's 100% psychological. So in fact, sometimes men can be under pressure to have an erection,
Right.
which has the opposite effect.
Especially if you've had a bad episode. So,
Yeah.
what you're thinking the next time is the bad episode, so it becomes, like a snowball
Yes,
going down the
yes,
hill,
yes.
right? Yeah.
And some of the and also there are some myths, like people think that drinking alcohol will help.
Will enhance your performance.
Yes, but actually will make it worse.
Right.
Maybe it will lower your inhibitions. So be easier to to have the courage to try to want to do something, but then the organic thing to make it really work mechanically, then it's working in the other way. So
Right.
and also there's lots of medicine that can interfere with the erectile dysfunction medicine.
Right.
So, for instance, if you're given sildenafil for
It's Viagra.
Yes.
It's Viagra. That's it.
well, I don't advertise brands
In
here.
Europe they don't do brands, but it's sildenafil is what they use.
Yes, well, that's the substance.
Yeah.
But in any case, there is medicine for fungus
Right.
that interferes with that. So, even if you bought yourself a pill for a cold or for a rash or for something,
Right.
you have to remember to tell the doctor what you're taking. If you're
Right.
taking tea or something, if you think, I'll take some herbal medicine and
So maybe it's a good idea for people, if they're going to see a doctor first, to maybe make a list of all the medication they're taking,
yes, especially if they
including the herbs or whatever.
Yes, and what I see also here a lot is that people go to one doctor that gives them a set of medicine, then they go to another doctor for, let's say, similar symptoms. The doctor doesn't know
What the first guy.
gives other medicine, and then people take both together or take a mix of them. Then nobody can know what is working, what is not working. So
Right.
and then taking some medicine for erectile dysfunction can be very dangerous, because you're mixing so many medicines, you're taking them in some strange way.
So you're actually putting yourself at risk at that point.
And maybe the erectile dysfunction is a side effect of these
medicine
medicines you're
combination,
mixing
yeah.
around without telling anyone, because let's say somebody as erectile dysfunction comes a lot together with diabetes. These are people who often have hypertension, often have heart problems. So there are a few medicines you can give for hypertension.
Right.
So you go to one doctor who will give one, and then but perhaps the patient is not sure, think, oh yeah, I went to the public doctor, he gave me this medicine, but this is maybe not good because it's the public doctor. Well, there's no public doctors are very good. There's no reason to, but sometimes they think that, so they go to a private one. They think the private one is better, but they don't tell the private one they went to
the public one.
Yes, they don't tell the public one.
Right.
They are going to the private. The private doctor gives other medicine, and then they take both.
Right. And they get into trouble.
Yes, and then none of the doctors will understand why some things are happening, because they don't know the patient is taking extra medicine. And for instance, you don't have it so much in Trinidad, but one thing that really interferes with medicine for erectile dysfunction. No, yes, I was going to say it's grapefruit juice.
Right.
So
that's a big culprit, that grapefruit juice, because it also
interferes with everything.
Everything.
And and people will have no idea what they're eating is interfering with something. And unfortunately, much of the research on these things is done on European or US fruit.
Right.
So I know grapefruit interferes with everything. I know oranges don't.
Right.
I know tangerines don't.
But there could be other.
But let's say I was thinking about Portugal.
Right.
Well, that I don't know, because to me Portugal is a kind of tangerine, but somebody told me it isn't. So.
Right.
But but that's because people who fund the research are from Europe or the US, so they're going to think about their own.
Right.
So
you're listening to 103 FM. This is Men's Health Clip Hour. My name is Dennis Webster, and I'm here with Dr. Flavio Cardone. If you have questions, you can give us a call at 628-4103, or you can choose to log on at 103fm.net, or maybe you just want to send us a text at 4103. That's 4103. So, Dr. Cardone, we have these diabetics, lots of them out there, who are wanting to know what are they doing these days to help diabetics manage erectile dysfunction. And what can they do at home? I think one of the things they can start with is probably making sure that their blood sugars are under control.
Yes, because remember that it's not especially diabetes that causes that. It's uncontrolled diabetes.
Right.
So if they are keeping their sugar under control, not eating things they shouldn't, then they can have a normal sexual life. But what happens is that they don't do that, and unfortunately, what really works in cases of erectile dysfunction is exercise and losing weight.
Right.
And there's no easy, fast way to do that.
Right.
Exercising means really exercising. You have to make an effort for that. And losing weight means going hungry. There's also no nice way of losing weight without feeling.
Plus, with fast food being so big these days, no one has the time to actually eat, like proper balanced meals.
Yes, but you can try. Even don't, instead of buying a fried chicken or something like that, dripping in oil or something.
What about maybe a consultation with like a nutritionist or a dietitian? Maybe
common sense things like eat a salad, eat fruit instead. You have so much fresh fruit here. In Europe, summer is only for 3 months. We don't have fruit the whole year. We don't have fresh vegetables the whole year. Here you have them all the time, so use them. Eat vegetables, eat fruit, and you'll feel much better once you start to lose weight.
Absolutely. No, I would like to stress the importance of checking with your doctor before you start any exercise program. I mean, there are some people out there who haven't exercised for years and years and years, and somehow get the feeling that they can just go out there and do a 100-meter dash.
Yes, also don't do that, because that's even worse probably.
And people get into cardiac issues. So before you start any exercise, program, we recommend strongly that you check with your family doctor to make sure it's safe to do, especially the particular program that you're thinking about.
But let's say that generally, if people start by walking
is a good start.
Yes, half an hour. Ideally, should be at least half an hour every day.
Well, you want to try to work up to 30 minutes a day.
Yes, right. But usually, I mean, if you're not able to walk, then erectile dysfunction is usually not your main problem. You already have lots of bad things going on. So let's say normally, people who can still walk and it's not so bad, they should walk half an hour.
30 minutes a day.
And I mean, I know it's hard in Trinidad because I've been here, almost a year. I gained weight myself because I try your bus up shots and things like that. It's very good, but then you get then you start gaining weight. Yes. But now you see. But for instance, first I tried to eat one, but
you can never just have one.
No. But what I mean, I started sharing it, so at least we were two people. And now we're taking a break.
This is 103fm.net. You can log on to us there. You can call us at 628-413. We're taking a break right now, and we'll be back shortly. Welcome back, ladies and gentlemen. You're visiting with me, Dennis Webster, and Dr. Flavio Cardone. And our topic this evening is erectile dysfunction. If you have any questions and you want to call into us, you can do so by calling 628-4103. You also have the option of logging in at 103fm.net, or you can send us a text at 4103. Dr. Cardone, in the break there we mentioned a very important thing, and I noticed in the article that we discussed earlier, they mentioned that with a diagnosis of ED, especially in the diabetic population, that cardiovascular disease can be expected roughly 3 to 5 years after diagnosis of ED in that population.
Yes, there has been a study that showed that, because the idea is basically, if you let your diabetes be so uncontrolled that it caused an erectile dysfunction, it's probably damaging other things too, among which your heart.
Right.
And but then there's another myth that we should address, is that some people think that sexual activity can cause heart problems. That's not true. What you have to do if you are being treated for some heart problem, is go see a doctor who, if the doctor knows if they know what they are doing, then they will assess you, probably give you a stress test maybe, and then divide you into low or high risk. If you're low risk, then it's okay. If you're high risk, you should see a cardiologist who will know whether you're able to have sexual activity and take medicine, and can treat your heart disease, and eventually, hopefully, make you low risk. If you end up being in intermediate category, then you have to take the stress test, and then either you pass, and then it's okay, or you've failed the stress test, in which case you have to see the cardiologist. And if people who never had the stress test, basically you just walk on a treadmill with electrodes attached to your heart, so your heart can be monitored during exercise.
While you're doing the activity,
Yes, it should be undertaken with a doctor present. I don't know how it is here, but that's how it should be done. And you can stop at any time if you feel tired, if If
you feel you can't go on anymore.
Yes, you just say stop, and that's okay. That's doesn't mean you failed the test or anything, because
so they'll evaluate you based on what you've done already.
Yes, because I mean, finishing the test up to the end is very hard. I think I only saw once somebody finishing the test, because you walk on this treadmill and it gets gradually faster and steeper.
Right.
It goes up at an angle.
So it becomes more and more demanding.
Yes, yes. So, it's really hard to go up to the end. But the message is, if you have a heart problem, it doesn't mean that you can't get medicine for erectile dysfunction.
Right.
It doesn't mean it's going to be dangerous.
Right.
It depends on what kind of medicine you're taking and how
the cardiac status.
Yes, and that's for a cardiologist to decide, not for a non-specialist.
Right.
Don't
your family doctor can advise you on that.
No, that should, if you have high risk. If you have low risk, then you don't need to see a cardiologist.
Right.
But this has to be assessed by the doctor. So.
Right. Now, the NICE guidelines. Now, NICE is the body that basically sets the guidelines for healthcare in England. Their guidelines suggest that ED, especially men with diabetes, be checked for ED annually.
Well, yes, but checking is also it's not easy to do, because the doctor is not going to ask you every time. And in theory the doctor should ask you every time, but doctors try to go faster, so they omit asking about everything. So for instance,
get those doctors to slow down and start asking these.
Yeah, well, if they did things like having computers at the hospital instead of writing everything by hand,
right,
then it would be much faster.
So we need to make some changes to get this right.
Yeah.
Right.
But because you see, if for instance, one of the things the doctor should do all the time is ask the patient if they smoke.
Right.
And if they say they smoke, the doctor should talk about the dangers of smoking, but all that takes time. And and people come to the hospital, they say they woke up at 5 a.m. to be there early at 8, and they're tired. And if instead of taking 10 minutes per patient, you start to take 30, and then you just divide the time, and then you see how much people are going to wait. So that's also the problem with asking everything. So the patient ideally should some things that trouble them, they should tell the doctor right away. Because the doctor unfortunately doesn't have the time to ask about everything. That's why I said it's important to find a doctor who has lots of time. So
maybe on the side of the patient now, maybe better preparation.
Yes.
On the patient side before you actually see the doctor. So you make sure you have your list of medications. You maybe have a list of questions that you want to ask.
Yeah.
Maybe in some order of priority, like things that are more pressing, more issues that are more pressing to you. You can put those forward first.
Yes, a very good thing to do generally, not only regarding erectile dysfunction, is to keep a diary of the blood pressure,
right,
and of the
blood sugars,
of the sugar. I was going to say,
right.
I mean, and not getting paranoid with this. If you don't have diabetes, you don't need to keep a diary of your sugar level.
Right.
If you don't have high blood pressure, you don't need to keep a diary of your blood pressure.
Yeah. Because sometimes doctors use that information to adjust.
Yes, because sometimes people have high blood pressure on the day they go to the hospital.
Oh, the kind of white coat syndrome.
Yes, because they are afraid of the doctor, so they get nervous, they get high blood pressure.
Right.
Also, an important thing and this, please, patients in Trinidad, do this. Some people think that the day they go to the hospital, they shouldn't take any medicine. That's not true. Take your medicine every day. Take your medicine also on the day
that you
go to see the doctor, because that's the only way the doctor can know whether the medicine is working or not.
Right.
Because if you're taking medicine to lower your blood pressure, and especially on the day you get to see the doctor, you don't take the medicine, then
and the pressure goes up.
Yes, then I have no way of knowing whether the medicine is working or not, because you're just showing me you have high blood pressure.
Another thing people I found very common is people saying, well, you know what, I'm not taking that blood pressure medication anymore because, you know, I'm feeling good now, my pressure is fine. And I keep telling them, well, you know, probably the reason your pressure is fine is because you've been on the pill.
Yes, exactly. So, yes, the pressure is low because they have been taking the medicine. And the moment they stop,
then they get that rebound. It goes, shoots up, you get a stroke, you get a heart attack, and then you get into serious problems. So take your medication, please, as prescribed.
Yes, and don't change it on your own, because I'm not going to say that each time the patient changes medication on their own it's bad. Sometimes they do it very well. So, you know, they get some medicine, they get an awful allergy. So, okay, go ahead, stop that. Or if you see and you know you're getting bad effects, then don't. But generally, when you start changing your medicine on your own, then it's going to be bad. You're going to make a mess of it.
And you're going to get into trouble. So stick with the plan. If you and your doctor have sat and create a plan, stick with the plan. That kind of brings to the end our show for this evening. I want to thank Dr. Cardone again for coming and joining us. And thank you, Greg, for keeping everything flowing smoothly. We'll see you again next Tuesday, 9 p.m. and 103 FM's Men's Health Clip Hour. I'm Dennis Webster, and good night.